Thank you very much for that nice introduction, Jim, and thanks to the organizers for allowing me to speak to you. And while preparing this presentation, I could not have imagined that it would fit so well to the previous speakers, because, Jeff, you were talking about these mini partnerships with organizations, communities, and that it is so essential for politicians. And Carlo, you are talking about the communities. And I will talk about civil society and a specific aspect that is, I think, very relevant, not only in Eastern Europe and Central Asia, but I think more and more in the rest of the world. And that is the shrinking space for civil society. But I will focus on Eastern Europe and Central Asia. And when I talk about civil society, I mean NGOs, non-governmental organizations, but all kinds of organizations and institutions that represent citizens. Because, it is really under threat now, civil society, and I will show you, and it really has to do with politics. And while I was preparing my presentation, I thought, should I say something about the war on drugs? Well, happily, Michelle and also Jeff mentioned it. So I want to point it out, but I will not talk about this. But of course, when you think about politics and public health, for me, there's an immediate link with the restrictive drug policies, which do so many harm, and that doesn't allow people who use drugs to health and healthcare. So I will not talk about this. And I also will not talk about the criminalization of people who use drugs, sex workers, and LGBTQI groups. That was already pointed out this morning by Michelle. I just want to tell you that 9 regional networks in Eastern Europe and Central Asia combined their efforts to develop a campaign, Chase the Virus, Not People, that addresses that criminalization. And hopefully we can continue and raise attention to this important issue in this region. And I will not raise, but I want to mention it, the situation around middle-income countries and the situation that international donors are withdrawing from middle-income countries. And I think that's also a political decision. It was already mentioned this morning, middle-income countries also face issues and HIV problems with the key populations at risk. And you cannot expect from a government where, for instance, drug use is criminalized, that they will fund healthcare facilities for people who use drugs. But I will not raise this, but I want to mention it. Here I come to the topic of my speech, and that is the shrinking space for civil society. And one of the major laws that has a great impact on that shrinking space for civil society is the Foreign Agent Law that was already a couple of years ago installed in Russia and is now also being under discussion, and some aspects already are installed in other countries in the world. So, what is important for civil society, and that is a background of this topic, and that is we face as civil society, and also my organization, AFU International and AFU Network, working in Eastern Europe and Central Asia, face more and more restrictive legislation. And this has a risk for the HIV response. And I can also look at that one. And the situation for key populations. But you know, civil society organizations who play such an important role in public health aspects, in reaching out to the most vulnerable groups in society, in offering health services, in offering psychosocial care, you know, we as civil society are resilient. And I would like to give you some examples later in my speech as well. So, AFU International has done an assessment, and a couple of objectives, the objectives of this assessment were that we wanted to know and analyze the situation in a couple of countries with regards to NGOs, laws and regulations. But we also wanted to know the position of NGOs in this legal framework. And we also wanted to know how donors are reacting on these NGOs, laws and regulations. So we collected data by desk research, and we did a literature scan, and we interviewed experts from NGOs, but also from authorities. And we also interviewed some donors and listened to their reaction and way of dealing with this shrinking space for civil society. This is a map from the Freedom House nations, and this shows the situation with regards to democracy. And I show you here Central Europe and Eastern Europe and Central Asia. And you can see the blue color in quite some countries in Eastern Europe and Central Asia, where it is said to have a consolidated authoritarian regime. Ukraine and Georgia are listed by the Freedom House as transitional government or hybrid regimes. And this tells you something about laws and regulations and how those governments perceive civil society and NGOs. It is a very challenging environment for civil society now. I mentioned already the foreign agents law in Russia, and for those who don't know, it means that if an NGO receives international money, they have to report that to the government, and they are registered then as a foreign agent. And they are then also more closely monitored for the work that they do. Recently, the Russian Ministry of Justice, so first of all, this foreign agent law was installed for human rights organizations, and then more and more NGOs fell under that law. And recently, the Russian Ministry of Justice also told that this applies for HIV organizations, and that if HIV organizations receive international funding, they have to show their project first to the Ministry of Justice, and then the Ministry of Justice decides if they agree with the intervention and the approach or not. And if you don't agree, then you cannot implement the activities. Like I said, it's not only in Russia that we have this law. Also in Tajikistan, there is a law on public associations, and that also obligates NGOs to notify the Ministry of Justice about grants and other aid received from abroad. In Uzbekistan, we have the same regulations, but there you also have to announce when you are going to travel abroad. So there is more control in Uzbekistan about the movements of NGOs and civil society. So what is the response to these challenges? What we can see, and I will elaborate a little bit more on the different strategies that NGOs take to cope with this very restrictive situation. But you see activists that are really willing to take the risk and openly criticize authorities, like Jeff already mentioned. They really, are demonstrating and advocating for change. But as a civil society organization, you can also reach out to public funding, like for instance in Russia, to the presidential grants, and then therefore decide to ally with the authorities. So you either fully obey or you silently continue your unpopular activities in the eyes of the government. So these are the two extremes, but in there are the different strategies that NGOs take. There are also countries in Central Europe that have quite a rapid shift of political environment and culture, and there is a quick decrease of political rights and civic freedoms, and this is happening in Hungary and in Poland. And there you see that NGOs, have to react on that change in environment. And you see the responses having different phases. So first of all, there is this strategy of, okay, well, silence, so we don't know what will happen. So we resign from advocacy. We do not attract too much attention from the authorities. And then you start concentrating on securing your status quo. And you limit your advocacy activities for further positive changes. But then, when the situation continues, you have to prepare for the bad to come, and then also to secure the sustainability of your organization, you have to find maybe other ways of fundraising. And that is what we see happening now in Poland and in Hungary. So although these countries had quite a good situation for NGOs, it can suddenly change. And I think that's also, I think, a lesson learned for NGOs. There's never a dull moment. So what are the donor responses to this shrinking space of civil society? And so we looked at a couple of donors, like the Global Fund, the Open Society Foundation, UNODC, Dutch government, etc. And we also interviewed a couple of these donors. And we see indeed that donors are withdrawing because they also want to get most out of their money. And if you give money to an organization who cannot do the work, then why should you give that money? So you see a withdrawal from quite some donors. But there are also donors who continue to give support, and they really find creative ways of enabling an environment where you can still fundraise and give financial support. And I think that is very, very nice and very good to see. So there is not just one approach of donors. But what does it mean that still quite a number of donors withdraw from the region? Because it has severe consequences for civil society. There was not that big money already for this region, but now with the pot of money getting smaller and smaller, you can imagine that there will be more competition among NGOs. And that the NGOs will tailor their activities to the wishes of the donor and not so much to the needs that are there in reality. You will stop with a number of activities. And then you have to rely on your domestic funding, also with the risk, I mentioned it already, a local government not supporting harm reduction activities in your country. So you are maybe then also limited, you're for sure limited in your mandate. So the result is that civil society organizations have to develop new strategies and innovative tools to cope with this situation. So in our analysis, in our assessment to the shrinking space of civil society, we identified 3 coping strategies, 3 categories, and that is the strategy of fight, hide, and unite. And I would like to explain first the unite strategy. And the unite strategy is that as an NGO, you reach out to the local authorities, you reach out to the government, and you offer your expertise in reaching their policy goals. And your professional expertise can also allow you, can function as a protection. So you're not completely, a governmental NGO. You have your expertise, but yeah, for the sake of your work, for the sake of helping the people that you were already helping, you reach out to the government and you obey to their rules. But it is not only uniting with local authorities, What is also happening is that you unite with other NGOs. You unite with other key populations. If you are an NGO working with people who use drugs, you work together with a sex workers organization or an LGBT organization, because together you are stronger and you can raise your voice more importantly. And this uniting strategy also, allows you to apply for presidential grants, domestic grants, but it also allows you to advocate for this social granting system. So you still have your agenda of creating more financial means for the work that NGOs and civil society is doing. You have to be fully transparent, and you work in line with the bureaucracy. And you include representatives of the authorities. And that is also, on the one hand, a good thing, because you train then governmental officials for the important work that you do and for the topics that you think are so important. The hide strategy, and that is that you tell the world and the government that you work in topics that are defined as public health. So you avoid talking about controversial topics and activities, but you still do so under the umbrella of public health. And you still do actually what you are doing, but not so much in the open. So therefore you do not communicate that much about your work you do. You don't do any campaigns. And another approach another element of this hide strategy is that you work under a regional cover. So you have regional activities. You may not be allowed, you're not allowed to work in one specific country, but you can invite people from that specific country to trainings in another country where it is allowed. You can also have informal networks of not registered organizations. So you do your work, but you're not registered. And of course that is difficult with regards to funding, but somehow organizations still find money. There's a lot of volunteer work, people with, it's already mentioned, with their heart in the right place and who are really willing to serve their constituencies, and so they work in this way. And the last strategy I want to discuss is the fight strategy. And that is that you do not apply for local funding, you do not apply for domestic resources, and you search for alternative funding. You do private fundraising, community financing, and you openly address the issues that hamper your work of the government, and that you can bring, for instance, these cases when you are in a very activistic organization to court. Again, there it is important not to do it by your own as an NGO, but to seek for alliances with other organizations and do maybe more regional advocacy instead of national advocacy. It is actually also, as an activist organization, it's very important to have a good partnerships, because if you have wide partnerships, you really stand stronger. So we identified these three coping strategies to this shrinking space of civil society. What I wanted to address is that it is also politics and public health, I think. It's really a pity that local governments perceive NGOs, some local governments perceive some NGOs as their enemies. And I think I mentioned it already before, and I think the speeches from Carlo and Jeff also pointed it out. Communities are such an important ally for governments to really have an improved quality of life for all the people in the countries. Another point that I wanted to raise is that none of these strategies are the best, I would say. And some NGOs choose not deliberately for a specific strategy. And what you see is also that NGOs come from a unite strategy into a hide strategy, or from a fight strategy into a unite strategy. So it's kind of fluent. And I think another important message that I want to give is that we as NGOs also should understand why some NGOs choose for that specific strategy. So it sometimes happens that an activist or an activist NGO, is a bit disrespectful to an NGO who prefers the unite strategy. But I think we all serve the same purpose, and that is a better health for all. Thank you so much.